Good morning, everybody, and hello, Ali. Thank you so much. I'm going to see if I can share my screen now, and we'll get started. Stop share. I don't think I did that right. Sorry. There, that should be working now. Thanks again, Ali. You and I have one thing in common, and that is up here, and it doesn't work that well with these virtual backgrounds, but I just wanted to tell everybody that I am thrilled and honored to be here. Thank you for that warm introduction. Thank you for all you've done for jack.org, everybody, and a big welcome also to the other speakers today. Fantastic day, how you're extending your reach now beyond just the Haskerades event. We go back a ways. This is a fun photo of myself and 9 others of our staff and young leaders who a couple of years ago were at an event, and we really just loved it. I remember that day as we all got dressed up in the office towards the end of the day and then headed up to the event space. It was really just terrific, and all of us really enjoyed that. I want to give a bit of a further background on a little bit about myself, but mainly about the founding of jack.org. If you had asked me 11 and a half years ago how we were doing as a family, I would have told you we were an incredibly fortunate, lucky family. I thought we had the 3 happiest, healthy kids going, Jack, Ben, and Julia. But that unfortunately wasn't the case. But just before I get into that a little bit more, I had spent my life as an entrepreneur, mainly in the automotive space and then in the software space. My wife was a senior banker with BMO. And then our world changed with a call from a police officer. So this was in March of 2010. And that poor individual had to come to our house, took about 3 minutes, and immediately had to tell us, and I'm so sorry for this heavy part of the story, but immediately had to tell us that we had lost our son, Jack. He had been found in his residence room that morning. He had died the night before by suicide. He was a first-year student at Queen's University. And, that sort of message, I still have empathy for that police officer and all the things that they do to try to support us all. But we were just floored. We had no idea that our son Jack was even struggling. I often say he took after his mother. He was intellectually very smart, never had trouble in high school, got into the university in the program of his choice. But when mental illness hits, and you should know that 70% of the onset of mental illness is during where we work. It's during what we call the transition years of age 15 to 24 approximately. And that's what caught Jack up. And, people weren't talking about this in 2010. And these kind of tragedies, I've dealt with so many families over the years. They're just unimaginable, but as I transition a bit now, I wanted to let you know that for some reason, with the support of our family and friends, we decided to see if we could do something about it. And this is a little timeline of the last 8 years as jack.org, but the 3 years before that were crucially important as well. So we started by Sandra and I making for us a very meaningful gift in Jack's memory to Kids Help Phone. And they are, at the time, they weren't really known as a mental health organization, but they were a youth crisis line. And we really wanted to do something. And what we couldn't believe is how our immediate community rallied behind us. And very quickly, we raised about $600,000. And that both encouraged me and frankly gave me a little bit of pressure that, boy, we got to do something here. And so we started something called the Jack Project at Kids Help Phone. And that was a 2-year pilot to not just dive in and do something, but actually see where we could make the biggest difference. And we were guided by the experts at Kids Help Phone, and we hired an evaluation consultant. And we did over 110 presentations to educators, to parents, and to young people. And what we found so clearly is that young people were being left out of this conversation, this most important health-related conversation for them. They were being left out of it, and that was just not acceptable. And that's where we evolved and tested our model. We shifted our funds to Queen's University, where Jack had been, and I happened to be a grad from Queen's. They had really, been empathetic about what had happened. They had lost a number of students at that time. And so we based our initiative there, the Jack Project at Queen's, for a full year. And the young leaders at Queen's who we engaged with helped us reach out to young people all across the country. That's when we had our first National Jack Summit. That's when young people started telling us they wanted to learn how to get involved all year long. That's when young people said, help us share our story in a safe and effective and hopeful way. And those are some of the underpinnings. But now, as you fast forward, we are an independent charity. So in July of 2013, based on that kind of pilot and research we did, we incorporated and immediately got our charitable status, and we became Jack.org, the National Youth Mental Health Charity. And as you can see on the slide, it's hard to believe how engaged our stakeholders, and particularly our youth audience, have been. We have over 65 staff now full-time, most in Toronto, but several in Quebec for our Francophone linguistic equity, and a number across the country as well in these virtual times. And that's important that we have a large staff, but what's really important is the 3,000 young people who volunteer in our programs all year long. And what's critical there is that peer-to-peer outreach. You know, young people, they don't really want to listen to an old fart like me. They want to listen to young people. That's where they really resonate. And that's been so important. So we're active in a couple hundred communities across the country. We actually have young people both on our board of directors, but also a really amazing, well-governed organization from a board perspective. Our board chair, Dr. Paul Kurdiak, is from a senior psychiatrist at CAMH, for example. But these young people, including our National Youth Advisory Panel, we call our network representatives, are incredible. And they really bring that youth voice front and center to our work, which is incredibly important. Now, I was asked to give a little bit of perspective on the pandemic and the impact it's had on all of us. And Ali alluded to this. It's been hard on us all for sure. But I'm not going to read all these stats, but there are plenty of stats that indicate what I know to be just common sense and sort of practical learnings that I've had from talking to the young people in our network. It's been hard on all of us, but especially those of us who struggle. And statistically, it's been hardest on young people going through this transition part of their life as they're transitioning from high school to whatever comes next. You know, about half of young people go on to post-secondary, the other half are looking for jobs, et cetera, many times moving away from home for the first time. All these kind of transitions at the same time that your mind and body is maturing have proven to be very, very difficult for young people. And I just think it's common sense, and we really have to understand and be empathetic to young people, what they're going through. You know, they haven't built their toolkits like some of us have over kind of a long period of time of being adults. But yes, the stats just go on, and crisis line calls are up. What I have seen in the research is we've actually had much more suicidal ideation and presentation at emergency rooms. Apparently, suicide rates are not technically up, and I think there's been a little bit of a protective factor in that respect by young people largely living at home. But I really just want to emphasize that it has been a very difficult time for young people. So whatever you take away from this conference today, think about it in the context of certainly your own mental health, and your peers, your family members, but particularly the young people in your life. Because if you can really learn a lot about mental health and learn how to be empathetic and have these conversations, you really can make a huge change in the young people's lives around you. And I also wanted to bring a little bit of the youth voice to this presentation. And it's incredible, how difficult it has been for our young leaders. And I won't read all these quotes, but also there is an element of hope. Young people that we found in our network who have learned the resilience by, the things that we're doing to sort of strengthen their toolkit, so to speak, so that they're learning how to take care of their mental health is vitally important. And, there's another stat that I just wanted to indicate to people that really should reinforce how important mental health is for young people. A few years ago, there was a significant national study done, and it showed that 53% of young people had their first interaction with the mental health system when they were in crisis or suicidal. 53%. So, that is like taking care of your heart health when you've already had a heart attack. And I hope that's not too blunt of an example, but you really need to learn how to take care of your mental health long before you're in crisis. And the system needs to really be adapted to deal with that. And to that effect, there's a lot of information on this slide, but I'll sort of explain it at a high level. A lot of our supporters have wanted to learn, where jack.org, where do you fit in the overall mental health system? And the fact of the matter is, there is not a highly functional system yet in the mental health sector. Things like cancer care have become so much more advanced in how they operate compared to mental health. And but it is important that you understand how the entire system works. And you can see the little star at the bottom. This is where jack.org fits in. And we are trying to reach the entire population before they're in crisis. And this important education that we do to reach all young people really is the start of the journey. And I have a vision going forward that, we won't just be reaching out with our content and our programs to young people, but they will be getting this training at school, frankly, integrated into their curriculum. That's a big ambition that we have. But as you look at this mental health pyramid, you can see that, in the second level, there are crisis lines like Kids Help Phone. In the third level, there's a sector which is community support. And this is something that is starting to expand now and getting funding from the governments, et cetera. It's at different levels all across the country. But these are youth-friendly places that young people can go to get some support long before they're in crisis. And then as you move up the pyramid, there's the costly interventions that you have in taking care of anybody. And I often use the example at the top of the pyramid is the acute care. And there are people, and I have been there, at the CAMH Queen Street location, for example, and many other hospitals, who are literally in full-time, very, very difficult care that is very expensive. So I just wanted to lay that out as the entire pyramid, because it's so important that we reach everybody long before they're in crisis. I often use the example, if you can teach a young person the dangers and harms of smoking, you will both help them take care of their own health, but you'll also have an offsetting effect to the healthcare system, because they won't necessarily need the treatments that they might get or need later in life if they, happen to become a smoker and addicted in that sort of way. So that's an important part. And I do want to, there's probably some business people out there, I want to emphasize how important from a return on investment point of view. And that's one thing we didn't know when we started, but we have learned from the evidence. And it just also makes common sense. If you can reach young people before they're in crisis and really give them the tools, the resilience that they need to kind of be taking care of their own mental health and supporting their peers, that has, again, a huge offsetting effect to the rest of the system, and therefore a very high return on investment. Now, I wanted to jump in and say, well, what do you do at jack.org? You know, you're upstream, you're peer-to-peer education, and that is very true. And we started these programs, our core programs, we call Jack Talks, Jack Chapters, and Jack Summits. And overall, the young leaders, we refer to them as our youth network. But we actually didn't make these up. We listened to young people, and I alluded to this a bit earlier, and said, you know, what would be the most effective way to help other young people? And it's incredible how they started putting their hands up and saying, we'd like to learn how to share our story. And that's what the Jack Talks program is all about. And so if you fast forward to today, each year we train about 150 Jack Talk speakers. And these incredible young people volunteer to go through about 50 hours of public speaking training to learn how to educate their peers, to learn how to safely share their story in a hopeful and non-triggering way. And the power of that storytelling is incredibly important. Our Jack Chapters program, I often call the kind of core of our mobilization on the ground. These are youth-led groups in high schools, colleges, universities, and in community settings. And what they try to do is keep this conversation going all year long. And they deliberately try to identify what the barriers to good mental health are in their community, and then reach out and kind of educate those young people, whether that be through sporting events or speaker events or art-based or music-based events. It's up to them. It's youth-led, but they figure out ways, and we share with them all the ideas of what's been done in the past to reach their peers, have this important conversation, but not just do it once. Try to do it all year long to make it a normal part of the conversation. And then Jack Summits are also vitally important. And that was the very first initiative we had, our first national Jack Summit. And frankly, we didn't know if, 10 people would apply. We were blown away when over 300 applied, and we accepted 200 of them to that very first conference. But now there are about 25 of these Jack Summits across the country every year at the local, regional, and national level. So at the local level, these are small events where, say, one high school will invite the young leaders from neighboring high schools, and they'll really talk about mental health as it applies to their communities. The regional events are bigger events, and there are 6 of them at the moment. There's one in BC, one in the far north that brings together young leaders from all 3 territories called our Northern Jack Summit, one in the prairies called Breaking Barriers, one in Ontario, the Ontario Jack Summit. There is a Francophone Summit based in Montreal, but for young people who are Francophone all across the country. And then finally, there's an Atlantic Jack Summit for the young leaders who are in the 4 Atlantic provinces. So all those summits together are really designed to connect the young leaders in the network, not the sort of outside population, but the young leaders who volunteer in our organization. We connect them to one another to build that community. We bring in expert speakers, and they really learn about how to take what they've learned and go back to their communities to make more change. So those are the 3 core programs. They've all, and I'll talk about this in a moment, they've all had to pivot during the pandemic, as you can imagine. But we have a 4th program that hasn't had to pivot during the pandemic because it is a digital resource. And this may be the most important thing that you can take away from my talk today. Be There is a resource that about 4 years ago, our young leaders started telling us that, boy, stigma is coming down. More and more young people are disclosing, and we would like to learn how to literally be there for them. We would like to learn how to support them, not as their doctor or psychiatrist or psychologist, but to be there as their peer, because we're on the ground, we're there closest to them. So we actually did another landscape scan and found there was no resource out there, both nationally or globally, that was evidence-based, deep in terms of content, and most importantly, that was really engaging to young people. And so we put the word out to our incredible supporters, like Hats On for Awareness, and we quickly raised $600,000 or $700,000. And so I want to emphasize this resource was not made sort of on the, on the cheap, so to speak. It was a big investment by our organization and continues to be something we invest in. It's at the only other website that we manage besides jack.org, that is at bethere.org. But it is a super important resource. There's been over 800,000 young people already access this resource. And kind of from an interesting point of view, we decided a little while back that we wanted to continue to enhance the resource. So it's a free resource anybody can use, but we wanted to learn how to train people who really work with young people. And this really resonates with me personally based on our story, because, I talked to that residence, Don, on Jack's floor at university, and he had recognized that Jack wasn't going to class, was basically isolating in his room, was not socializing, but he wasn't trained. He was a lovely young fellow, but he didn't know that those were classic signs of mental health struggle. And that's what the Be There certificate program is all about. And so this is another doubling down investment by jack.org, really critical during these virtual times, but will also be incredibly important going forward. And the fun part about it is we actually got reached out to by a US foundation, and their founder's a little better known than me. Her name is Lady Gaga. Lady Gaga and her mother founded Born This Way Foundation, and they reached out to us when the pandemic hit and said, "We love your Be There resource. How can we get involved and spread it around the US?" So that is really interesting. As a Canadian charity, our work is in Canada, but we partner with international organizations to openly share what we do to try to increase the impact and help more and more young people and those who support them. So I encourage you to check out the Be There resource. And then I did allude to the fact that we had to pivot all of our programs. So that has been something that I'm incredibly proud of our savvy young team. So we now do something called Virtual Jack Talks. We've just recorded our second edition of our virtual talk, but also we do, and this is very popular, live stream talks. So we can actually zoom in to young people to give a live talk to a classroom or a grouping of young people in a community, et cetera. And we have a home edition of this talk and a classroom edition, and we provide resources to the teacher, for example, to help take their young people through all of this. That's pivoted very well. We did over 800 of these Jack Talks last school year. And then just carrying on, our virtual Jack Summits have actually gone very well. We've noticed the attendance is a little bit down, and I attribute that to Zoom fatigue. We're probably not as many here as we were at the Hatscarade, where people can come and have fun in person. But the effectiveness of these Jack Summits virtually has been unchanged, and we're actually going forward looking to do a hybrid model. So we will be able to have more participation, because not all young people can leave their town or city and come to Toronto, for example, but they want to participate, and giving them that flexibility to do that remotely is super important. On the Jack chapters, this has been candidly the most difficult one to support, because at a lot of schools, got canceled. So, but our social followings, and they do virtual events. They're just now starting to get back into planning in-person events. But historically, everything was in person. So that has been a difficult one, but I'm really proud of how the team already was a digital resource, and the need for it really exploded during the pandemic. I wanted to touch just a tiny bit more on the Be There resource. It is super important, and as I mentioned, this is not something we built quickly off the side of our desk. It's a very deep resource. It's based around something called the 5 golden rules, as you can see here. And there are a number of what I call explainer videos, stories of a young person and their friend, or a brother and sister, or a mother and daughter, and how one has learned how to be there for the other. And those explainer videos are just short and crisp, represent a very diverse audience, but really bring these 5 golden rules to life. And, you know, I just myself, as I support, certainly right now at the moment, a family member who is struggling with her mental health, it's just incredibly helpful to refer and remind yourself of these very simple and kind of crisp golden rules of how to lean into these difficult conversations. So it's super important. It's a free resource for anybody. I'd encourage anybody who has young people in your life to share this with them, but also learn yourself, because you never know when you're really going to need to lean into these conversations and support a young person, whether that be a son or daughter or just any young person in your life. So finally, I love sharing this image here. This was our most recent in-person National Jack Summit. It was in in March of 2019. We're hopeful to have a hybrid event this year for the first time. But these incredible young leaders, I often call them the varsity athletes of mental health. They are incredibly passionate. They immediately connect with one another because of they really sort of get the importance of this. The vast majority of them have lived with mental health struggle, and many of them have diagnosable mental illnesses, and they just want to pay it forward. And there's a real magic, and I know how much it's helped me and our family. You know, if we had just gone and sat in a corner, I don't know where we'd be right now, but it has really helped us. And I see how it helps the young leaders to be open about what their struggles are. And as they build their own toolkit, help others really helps them in return. So in conclusion, I just want to thank again the entire team and the board at Hats On for all the incredible work that you do. We're all so grateful at jack.org. If there are any questions, I am going to now turn off my screen and be happy to answer any questions.
Thank you so much for that, Eric. Gosh, I got to tell you, I was, you know, it's Hats On, and this is not the Hatscarade, but a little part of my mind was like, I wonder if I should wear a funny hat and come back with a new hat after every speaker. And God, am I happy I didn't, because that is, I wouldn't want to take away from anything you said as far as your messaging goes. And I really appreciate all of that. And again, I preface this all by saying I am a father of 4, and every couple of weeks we do have discussions about, you know, parenting, kids. The pandemic is obviously a huge part of all of it. So that was incredibly illustrative. I will say once again to our attendees here, the questions, any questions you have, this is a great forum and a great a time. You know, I think you can see, you saw Eric's all-star team. Eric works with a lot of people, so to have Eric's ear for this short period of time, I don't think you will get that. He's obviously a busy man, so if you have questions, please do ask. Now is your moment. We've set aside the next 7 to 10 for Q&A, and we'd be happy to hear from you. I wanted to ask you something, Eric, that occurred to me in this moment. You know, I'll be very candid that I had financial issues for most of my youth. Going into my 30s, I was at a point where I was going to declare bankruptcy in my mid-30s, and only because of my father's begging, I didn't do it in the end. And then I hear about this drive, you know, while I'm in my early 30s, this drive, people want to bring financial, you know, just teaching financial responsibility in high schools. And I was like, oh my God, of course Of course, how many friends and I got credit cards not knowing what it meant and went wayward. And I heard you say something similar about mental health. You want to bring it into high schools. Can you tell me what that would look like? Would that be like something as for a certain grade? Would that be sort of a weekly thing? Would that be mandatory? Would that be voluntary? What would that look like? Because you said, you know, at 15 to 24 is that age group when these mental health issues really start to, you know, whatever you want to percolate, I guess. So for young kids, do we want to have, you know, 11, 12, 13, 14 year olds there? And is that part of your messaging that get this message out early?
Well, all good points and good questions. The way I would answer that is, you know, I do have a business background, and so my natural inclination was not try to sort of dilute our model and try to do everything for everybody and therefore have a reduced impact. So because our story resonates with these transition years, and you know, I was advised by our board, etc. You can't do everything for everybody, so pick a focus. But you're absolutely right, Ali, that yes, it's really important to younger kids as well, you know, in elementary and middle school, because our programs are sort of leadership oriented and we're doing it through young people. We have chosen to stick to that high school through post-secondary roughly age. I say 15 to 24 plus, because we don't kick out young people if they're 25 and they still want to be involved. And certainly if somebody wants to get involved and they're a bit younger, there are ways they can do that. But the main focus is we've really sort of stuck to our knitting to try to have that outsized impact. So for many years now, we have been creating, I would say, very high quality content that is engaging to young people. You know, things like the Jack Talks are great examples, but we do other things with podcasts and video documentaries of young people sharing their stories, etc. We create that content, and then schools and young people reach out to us and we integrate. Where I think the real magic, and this is getting to the root of your question, you know, I think every young person deserves to learn about mental health. And, you know, instead of reaching a very large population, you know, we have ambitions to have interactions with 1 in 4 young people in Canada, which is pretty ambitious. But all young people deserve to have this education. And a lot of our content that we create can be kind of pivoted and used kind of as more formal curriculum. So this is not something that will happen overnight. It's something that is going to take some advocacy with both school boards, and we do have a number of school board partnerships already, but primarily with the ministries of education, because the way Canada works, and this is, you know, a great country, but we have a federated healthcare model. So that means that decisions are made for both healthcare and education at the provincial or territorial level. So it does mean a lot of advocating with, you know, provincial ministries of education, for example, to, you know, pilot some of this and then get it rolled out across the province and then eventually rolled out across the country. So it is, will take serious investment. It will take serious time, but I am committed. You know, I am certain this will be something that will be happening within, you know, all school systems. And the content will have to be contextualized for, you know, obviously you're going to have different content for a grade 12 student than you would a grade 9 student. It probably won't be in the curriculum at post-secondary, but more how students are welcome to that post-secondary, how that, you know, wellness activities are integrated, how professors talk about deadlines and are respectful about mental health, etc. So you're really coaching those post-secondary institutions how they can integrate these conversations much better. But I think the core of the curriculum will be at the high school level, where it's most important.
I have some high hope that this will be in high schools, you know, sooner rather than later, because I saw what a friend of mine, James Cunningham, did. He created this program called Funny Money. And when he approached high schools, first in Ontario, then across Canada, saying, we'd love to come in and teach young people about money, the first thing was like, we don't have any budget for it. We don't have any budget for it. And he was like, never mind money. Let's say you didn't have a budget for it. What if we could bring it to schools? And he had sponsors who helped him get in. And I've spoken to young people who did the program and they still remember it 6, 7 years later. And he was able to do it through humor. That was his background. But I think mental health, we're at a place, and I think the pandemic, quote unquote, would have helped us get to a place where, the province and ministries will see a need for this. So I'm very hopeful. I hope that's, I hope to see it while my young kids, by the time they're in high school, I hope they have education.
Well, I think I'm very hopeful about this. I'm very hopeful, frankly, I'm hopeful about the space because, and if anything, the pandemic has been a bit of a backwind to help people realize the importance of mental health. If there's anything good about it. I mean, doctors are calling mental health the second wave of the pandemic, and it all just kind of makes sense. So I think as we build, in this area and we figure out how to reach out to those curriculum organizations as well as the school boards and ministries of education, this is going to happen and we want to be part of it. And I think with the work we do, we can also be a cost-effective way to do it. And the school system won't have to kind of reinvent these resources because we will have a lot of them already. And we'll be delivering this with a lot of content that is that magic peer-to-peer content.
Sure.
Yeah.
I was
just
also
like you mentioned, just like financial literacy, mental health literacy is something that we all should have, right?
Absolutely. And I was encouraged to see so many young people of color in that group as well, because it's a little bit of a different conversation. Person of color myself, growing up with people whose parents, fled civil wars and asylum seekers and this kind of stuff. There's a lot you don't talk about. There's a lot you bottle up in homes. You certainly don't have, it's not very common to have the sex talk in houses. I mean, and that might be changing, but in my generation, these were all things that parents were like, we immigrated here, we sacrificed everything to be here. Now, please do the right thing. We assume you as our children will do the right thing. And that this, those are mutually exclusive things. Doing the right thing and falling prey to mental stress are not, these are things that are no fault of your own as a young person.
Yeah, I'm glad you brought up that whole issue of, for example, racialized audiences or newcomer Canadians. There is a fact that your entire audience here should understand, and that is very different from the physical health system, where, in Canada, we're very fortunate with our physical health system. If you break your leg, it's a bit of a corny example, but if you break your leg, you know where to go, you can get a cast put on, and it won't cost you anything. In the mental health system, it doesn't work that way. First of all, people won't know where to go. The large majority of people have no clue where to go. And often they won't have access. There could be a wait line, there could be cost barriers. But the other thing, and you mentioned this with, we have a very diverse network of young people. This is an absolute fact that those who are from underserved audiences, and if I categorize those by newcomer Canadians or Indigenous Canadians or racialized groups, or just simply lower socioeconomic, those are known by the statistics to be at higher risk of mental health struggle and have the lowest access to service. So it's very important to our network of young leaders. Sure, there's kids in our network that are from independent schools and their parents could afford whatever. We need them talking openly about their mental health, but those underserved populations are extra important. And getting contextualized, available, affordable resources to those young people, starting with the education, is critically important.
Eric, just as we were wrapping up, there was a few comments of just sort of like encouragement and thanks here. But one question that we had here from a gentleman named Gord McKechnie. He works for Durham Outlook for the Needy, or it says Our Look for the Needy, but it might be Outlook for the Needy. He's asking if we can attend the youth conferences to hear from kids on what's important to them. so that as senior adults, we can, better understand and presumably better help. I know you said that there are other resources like the podcasting and that kind of stuff, but as far as the conference goes, are people, older people able to attend those?
Candidly, no, and I'm sorry to say that they're a youth conference. We have experimented with that kind of model. We do put together a lot of content. All the speakers are, for example, recorded, the collaboration sessions. So there are ways you can access the content. But if you think back to, that image that I showed you of all those young leaders, the only adults in the room, so to speak, are some of the staff, some of the sponsors that are there. But we really want it to be young people for young people. So we are experimenting with some ideas to have a separate day at our National Jack Summit for decision makers. So to bring in those people, but there's lots of content that we do share that would be helpful. I also noticed, I think, a question about, do you also provide any support for caregivers like yourself? And I do want to clarify, jack.org is not a service provider. We are that upstream education model. The vast majority of our work is that peer-to-peer education work. We also advocate for what we call systems change. So advocating at a local school or in a region or nationally. For example, we've had the federal Minister of Health twice at our National Jack Summit to sort of connect those youth voices to decision makers. But we're not trying to be there and compete with the actual caregivers. We're more to help young people navigate to that care. And that's the differentiation of where we fit into the system. So yes, resources like Be There and others at our website, jack.org/resources. We have tons of resources, but we don't actually provide clinical support in that sense.
Okay, great. Thank you so much, Eric. Thank you for today. And of course, for all the work you do across this country. As you said from the beginning, you just never know. You just never know when and how this might affect you. And so this is more useful than any of us can even probably really realize, because you just, and you said, even though your family is so well versed in this now, again, you are dealing with somebody in your family again suffering from stuff. So this is not going away, and so this is incredibly valuable. Thank you so much.
Thank you, everybody, for being here today, and for hats on all the support you provided to jack.org. Have a great rest of your day, everybody. Thank you so much.